All right, what's up, folks? Guerrilla Radio episode 22, back with number 4 of our 4-part series on fixing low back with Dr. Nagel and Coach Susie. So, video 1, we talked about mechanism of injury. Video 2 is all about screening. Video 3 is all about mobility. Today it's about activation, right? So, we've identified the cause of the problem, and we've mobilized that tissue, try to get some more range of motion. Today we're going to kind of help stabilize, integrate, activate that kind of musculature. So Dr. Nagel is going to do a rundown of how we would break down certain movements for starting with bracing and core stability and then going from there. So where do we take it from here?
So one of the things we're going to talk about first is tissue sparing, and then we're going to try and use positions to help with activation, right? Cueing. So if I just say contract these muscles, most people can't do it, otherwise they would already be firing. So we're going to start with, we talked about first the screen when looking at abdominal coordination, laying on the back, looking forward, and we're looking for, lay up here real quick, just a quick synopsis. Looking at the toes, curl forward, and we're looking for rectus firing, oblique firing, equal firing all the way around, no rib flare, so everything's balanced, right? When we don't see that, this is where we're going to initiate just bracing. We're going to start with just bracing, and so we initiate bracing. You can do it one of two ways. One is standing up, and the other one is laying down. It's easy to do this because we can start to progress from it, and then we take it upright. Does that make sense? When this is solid, go upright because it's harder. So one of the cues may be pushing on the obliques. So if that's really where one of the biggest issues are, if the obliques won't fire, we'll cue by digging, and you'll see I dig pretty deep, and I'll say push it down to the floor, create abdominal pressure. So I want her to push her back flat, create abdominal pressure, and I want to feel it all the way down into the pelvic floor, like a Kegel exercise, right? And so as we get that, you'll tend to see that if somebody does have a diastasis, it starts to drop. The diastasis is that separation of abdominal, and the raising of tissue. So that's the very first step in that progression is, can you just brace, push tight, and hold that? And even really strong conditioned athletes, as soon as you get them upright, they can't do that anymore. Just being under body weight, their body goes back to hyperextension or whatever they were doing initially, okay? So bracing there, we progress that into a dead bug exercise. So all this is using her legs as leverage, right? So from here, it's just, there's no leverage on the spine. Once the legs go up, same exact mechanics. She's at 90 degrees in the hip and 90 degrees in the knee, or in the shin. The premise behind this is hold that, and a lot of times we'll just teach a Tabata structure, 20 seconds on, 10-second breaks, and start building. When you can get through 10 rounds of Tabata structure, 5 minutes, then we'll then progress that to going out with one leg, right? Okay. And we may start at 45 degrees and then slowly go down. And then we just alternate each set, the other leg goes out. But I want the major thing that we talk about, these are principles. So if I got equal firing, then I need to build strength and endurance doing that, right? So my legs are then leverage, and it's a very controlled way to start building strength and endurance with a really controlled core. Does that make sense? Yeah. So that's the very first step. The second thing is, we've now got some coordination and some knowledge of where we're at laying down, but now what do we feel like standing? So go ahead and stand up for me.
And so we're talking about, a good test is if we're not getting that abdominal coordination from the screening, we would start with our litmus test to be holding that dead bug.
Yeah.
Okay, 10 rounds.
10 rounds, yep.
20 seconds hold, 10 seconds relax.
Yes.
And then as you complete that and you can manage that, then we're starting to extend one leg at a time. Left, right leg, and then maybe both. You get into both.
Absolutely. I mean, you should. So the reason that most people in gym class got killed when they do leg lifts in gym class, they'd have to put their hands behind their back, is it was too much leverage on their low back. They didn't have the stability.
Or the hollow body.
Or a hollow body. Like we deal with a ton of gymnasts, and because my daughter's a gymnast, and because of they start doing hollow body rocking at such a young age, oftentimes they get so much leverage on a small spine that they get strong, but they get really strong in this abnormal pattern. And that's part of the reason you see so many very damaged.
Step 5 instead of starting at step 1.
Yeah, they're just, I mean, at 4 years old, she couldn't hold a hollow body rock with good mechanics. So her being, when she's constantly working that, she's getting really strong in her dysfunction. Okay. Right? Cool. And next step, facing that way, you can do it with hands and your hands, or somebody can cue you, is just push your belly really, really tight. Just bear down is like typical cueing we use.
This is where you might use a belt.
Belting is an awesome tool because you can do it both for activation, but while you integrate, so you can feel that pressure if you're starting to go into a squat and things like that. So push your belly really tight, and everyone's going to have their little nuance of where their dysfunction shows up first. It may be that the lack of firing the obliques. It may be the diastasis starting to push out. That's what we like to teach when we see that on a person. We want to say, watch this. When this shows up, you're in dysfunction. Like you're starting to go the wrong way, right? So we'll start with that. I mean, literally, it's very simple. Brace tight, create as much abdominal pressure as you can. And what that's doing is taking the load off the paraspinals, right? If I create pressure in my abdomen, then these big muscles back here don't have to work so hard to keep the body upright. Okay. If I don't create that, then I have to rely on extension from contraction right there. And like I told you, it's like if you take the stack of quarters, squeeze on one side, it's going to go forward, right?
So I think that's important too, because I see this sometimes in newer athletes where maybe they'll do some kettlebell swings, or they'll start doing some very light kettlebell deadlifts, and their back doesn't hurt, but they feel the paraspinal is just on fire. Like nothing is working harder than these just two muscles right here.
Yeah.
What that's probably telling us then is we're not engaging anything.
Right. So you got an athlete and they're fit. There's no reason they should have a problem. That's a great time to create. Use the belt then as a cue, right? If they got good firing.
This is important. The belt is not a crutch; it's a tool that we can use.
Yeah. So the belts are misunderstood oftentimes because they're misused. So every tool's got times to use them and times not to. So when Susie puts the belt on and cinches it down, most people's understanding of using a belt is that they create passive pressure, stability, so they don't have to think about it. That's not the point. When you wear a belt, if you create pressure against it, if you push against it, you brace like we talked about against it, the belt creating that pressure. I mean, anybody that's used one knows that you feel substantially more pressure than you can create on your own.
It's like a mental cue to create more tension.
And that's why we like it. So we like it mostly because it's a cue. If I've got bad balance, I can put my finger on something and have it stay there all day, right? Like anybody seen that? That's what that is. It's a proprioceptive cue for the person. And so when I start to complicate things and say, next thing we're going to work on is hip hinging. Well, I need to hold that bracing position while I move through the hip. When patients don't do that, we see this or we see this. They go into their fault. Does that make sense?
Yep.
So that's the next thing we're going to work on is just a hip hinge. So you can do it from the side. What I want you to see is she's going to move here, not through her hip. So if I put my hand, and this is the kind of litmus test, if I put my hand on a sacrum and up at the lower thoracics, go ahead and hip hinge back, my hand should stay in the exact same spot. So and this is literally what we'll do with patients. Go and stand up. We'll put our hand right there, and we might snug them on both sides where we have one hand here on the ribs too, and follow them into the movement. Because what you'll see is very quickly, if she's a hyperextender like that, the front hand's going to slide. You're going to feel it. If she rounds, if she goes into flexion, you'll feel either the palmar side or the fingers slip. So the faster you can get the person, the earlier in the movement you can catch and re-cue, the better it's going to be, right? If I initiate into flexion and then go into a squat, I'm not going to fix that at the bottom of the squat under heavy load. Yeah. Does that make sense?
Yeah. And this is great from a coach's eye perspective too, because sometimes we'll look at a really good squat and we think generally the macro level, the mechanics are all there, but if we're looking at nuance, if we're looking at the micro, we're noticing how we load the spine in a different way. So I think this is a great cue for anybody, even if you're just doing it to fix back pain or you're coaching somebody somewhere, to look at what is being loaded first in this movement.
Yeah.
This is important.
This is the beginning.
This can be boring, unsexy stuff, but this is...
It's the beginning of everything. Yeah. It's the beginning of everything. So the cueing with that is move through the hip, push back. And what we don't want is do a faulty one with the knee. What we tend to see when people initiate, yes, that's exactly what we tend to see. As a coach, how often you see people getting beat up that initiate every movement into their knee, right? So we want to initiate in the hip, go ahead and hip hinge back. And what you'll also see is if after that squat screen, if we saw, let's go ahead and face that. Actually face the camera so they can see this. If we watch the knees want to collapse and go forward, this is oftentimes where we see it, and they run out of real estate really quick. So they'll go there, go and come back up, or let your knees go forward. You'll see them round very quickly because as they go forward like that, the acetabulum binds. There's no room in the hip, and so they'll go forward. When their knee runs out of real estate, they start going into flexion, right? So bracing, hip hinging. Now a dynamic.
Talk to me about progressions. What would be some prescriptive methods on the hip hinge? How many times
So-
rep scheme?
It's not so much a rep scheme. It's more about depth.
Okay.
We want to. This is an activation. I mean, it's just finding the movement. So as I go back, I always tell patients, I want you to feel that tension in your hamstring, and don't jump away from it. Right? Most people feel that and they round or they jump away from it. Push into it. I rarely have anybody stretch hamstrings, and we get tons of mobility in the hamstring because most people don't know how to load it. Once you start loading the core properly and loading the hip, the body says, okay, I don't have to stay so tight. I can loosen up.
Yeah.
But we'll do butt touches. So we'll find a target, whether it's a wall. This will work for now. We'll find a wall and just go back and work on getting depth, and then take a step out. And you'll see that what might only be that much a step, going forward with your feet, can feel like a mile going back.
Okay.
But again, when you're globally looking, you want to see how much mobility are we really gaining, right? Is it enough to get into the movement? So if somebody's getting beat up doing deadlifts, you get them in this position, and the deepest they can get is right here, and they start to falter. They don't have anything beyond that. You probably should start either elevating the bar or start doing rack pulls.
Okay.
Working on core stability and hip mobility, and then your rack pulls are going to help you get more mobile. See what I mean?
Yeah.
Kind of an advanced step to it. So, dynamic way to do it is kettlebell swings.
Now I know we're fast on the sweat.
Okay.
All right, let's try that.
Okay.
So we're going to go through two ways of doing kettlebell swings. CrossFitters tend to do mostly American swings, and for those of you that are already having problems with this stuff, you jump right in. We see all these issues exaggerated a little bit. So go ahead and show what you tend to see when you see an American swing. That wasn't that bad actually. Go crash forward a lot more. So we tend to see, that's what we tend to see. We tend to see a very forward crash because that person's already quad dominant, they're already having the hip dysfunction, they're strong there, and you can't get away with that with a Russian swing, right? You're all over the place. So go ahead and do a Russian swing, and you'll see that's just a dynamic hip hinge. Her shins stay vertical, she sits into her hip, she's loading the hamstring, she's keeping her spine tight. So this would be a dynamic movement with core activation stuff and starting to integrate into hip activation, right? So it's kind of jumping into, in the model we use, mobilize, lengthen, activate, integrate. It's kind of in step 4, but it's got that in-between step.
And we're
right?
still thinking, so just as you're building all this together, we're bracing midline, we're bracing the core, we're working the hip hinge, and now we're just adding a little bit more range of motion, a little bit of weight, a little more dynamic movement.
This is a way easier thing to start with before you jump into Olympic weightlifting or something, right?
Totally. Yeah, I think that's a really important cue too, because he said it. We focus on it too when we're in class, is that shin angle. Right, when you first start this kettlebell swing, because that is the biggest thing you're going to see. You're going to see chest way further down even than that, and you see people bending those knees way far forward. That's not how we start this.
Yep.
Right, we started the way we just went over it with that vertical shin.
The key is, if you clean it up so you can do everything, then you can go back and forth. Most people don't have normal patterning, so a lot of the movements in most gyms, not just in a CrossFit arena, whether you're high bar back squatting, low bar back squatting, people are going to fall into that pattern. So I think that it makes more sense to peel back and start working on this stuff and learn those movements to fix that, like a low bar box squat, which we're going to go over next, like a Russian kettlebell swing, and clean that stuff up. Working on the dead bugs and stuff before we go into like bird dog exercises or more advanced, more integrated core exercises. But clean the stuff up, and then you can become real fluid going back and forth.
Yeah, totally.
Last thing we're going to do is actually that. We're going to hit box squats. So, when we're doing this movement, what I want you to pay attention to most, I'm going to slide this back just a hair further, is, Susie, go with a wider stance. If you're using positional activation, you'll find that if your legs are wide and you start to sit back, it makes it so when you get down into the box, when I get down to the target, if my shins are upright or even slanted back, my spine is nice and tight and straight, I can only get up if I'm using my glutes and my hamstrings. I'm pulling myself up. So if that's the deficiency, this puts you in a position I can only move by doing that. Some of the biases we'll tend to see are a rock to get up, but most people want to go like this,
Yeah.
right? So they can still recruit, or they'll get kind of funky and start twisting. So the more we can work on feet staying wide, opens up my hips, I can move my body forward.
Back in if I were you.
Yeah, give me 1 second. I can get my body forward and I can come back up, and pull myself up through my hamstrings.
So we're talking about if somebody's never done this before and they're asking how should I set up, talking about grip,
your stance,
width, and all that.
Find your normal stance and then get really uncomfortably wide.
Okay.
I mean, if you're doing the splits, you're not going to be able to move.
Yeah.
So
we're definitely
generally
outside the
speaking,
shoulders.
well outside the shoulders,
well
right? You know, depending on height. So obviously you're quite a bit taller than me. You should have a wider stance myself. But we're going to see, generally what I see is most people want to stay so tight and so narrow that going shoulder width might feel narrow.
Okay.
You know what I mean? Go uncomfortably wide. When you sit back and down, when I look at my shins, I should see the shin angle is at least vertical. But oftentimes, surprisingly, you'll see that you can actually have your shins slanted back as long as your knees are out enough to get in position. Does that make sense?
So as long as the knee is not in front of the ankle.
Yeah.
Fine.
We're good. And then the depth. So when a lot of guys are like so focused on getting below parallel, I'm not opposed to that, but how you get there means more to me than how deep you can go.
Okay.
Right? If you screwed up when you first started the movement, then it's not so good, right? Or if you hit parallel and you start tucking underneath, then every bit of that movement after that's going to start creating some problems. So unless you're doing this for money, like it's a job, I wouldn't try and get that extra bit of weight for the extra range of motion.
Yeah.
Like the return's not there, right? So I'm going to go through then with weight, with bar position, because that makes a big difference in this. No, because I wanted to see your back. So when people do a typical high bar back squat, it's going to be oftentimes sitting pretty high on the shoulder. We're going to use this as kind of initiate into the next week. So Susie's going to before she moves, she's got a wide stance, her belly's super tight, like she's braced nice and tight. And the cueing for that would be, as you sit back, sit as far back into the box as you can. Good, and keep that shin nice and upright. So what you'll see is the higher this bar sits, the more it makes her want to crash forward too, right? This lends itself more to a high bar back squat. So pulling those shoulder blades down and back and letting that bar get lower, whatever as low as you can tolerate, is going to help your center of gravity quite a bit, right?
Yeah.
So let your body fall forward, good. So when I say that, I mean hit at the hip, right? Not at the spine. Squeeze and come on up. Good. And then one of the ways that we start adding depth is this is a pretty easy depth for England racket. One of the easy ways that we start working on depth with this is you can just take plates and set them up and just work your way down. I mean, most people, especially if they had some background squatting, you can improve their depth really, really quickly and get them down to parallel or below, I mean, in one session.
Yeah. And I think that's a good point because I think especially if you're already in the CrossFit world, we have a tendency to want to do everything fast and heavy before we're ready. Like it's just a matter of intensity. So the mental litmus test I have is you leave today on that session saying I could have done more, I could have went deeper. Because if you start with, let's say, 4 10-pound plates and you do that and you say, I could have done more, great. That's a great starting point. Then go to 3, then go to 2. As opposed to the other side where you jump right in, oh great, this is a good rehab tool, and you jump right into something very heavy, very low when we're not even ready yet for that. So always err on the side of caution, and
it smokes you.
It can, yeah.
I mean, if you're not used to doing this, if you're used to a quadricep bias when you're doing movements, and you do this, I mean, it smokes you really quickly with low weight.
Yeah.
Right.
And it's a tendency of finding this new trick that you get to, but look, like, this is basic stuff that we need to build up on and do it well. What I think people get in trouble in is they find this new hack or this new way to help fix something, and then they just
that's what they do.
Crush it, right? It's hard to, well, if I need to go low bar back squat, I need to go as low as I possibly can. Let me go as heavy as I possibly can. And what we end up doing is just creating other issues that we're not just ready for.
Right.
Take this stuff, remove all ego from the equation, start slow and ease into the process. That's how you build a good foundation like we were just talking about a minute ago.
Yep.
Okay. All right, so we got box squat, low bar back squat.
Yep.
And what was the next thing we were going to talk about?
You wanted to mention doing clamshell exercise, glute med stuff, which I think is fantastic.
Yeah. So give us a clinical breakdown of glute med and its effect on low back pain and how that might come into play.
It's really a matter of where the glute med and glute max, how they stabilize across the actual femur head, right?
Gluteus medius.
Yep.
Talk to us about the structure, the anatomy of this first. I guess people don't know.
Well, I mean, it's going to sit under the glute max, right? The glute max is going to be the bigger guy. It's going to pull you back and externally rotate here. Glute med is going to create internal rotation. So the combination of those two forces on the hip creates stability between the hip and the pelvis, right? And it creates, and what we tend to see is that a lot of people really struggle with stability there. It's one of the things that we didn't screen the best for in our screening thing. So I can show like 20 seconds before we introduce. Lay on your hip for me. So you can have the person internally rotate your hip, raise up and back, and we can watch how well they do with stability, and you can challenge it as well. It's profound how often you see somebody put them in this position, and you drop it, and they do that, right? Like I'm gonna let it go, hold it right here, and their hip does this, and then you feel all the compensation around trying to keep that position, right? Or they immediately go right here. So there's other tests that are used clinically called Trendelenburg's, where you're holding your hip up and you're looking for a sag. Deficiencies are harder to see there because people can be really good at compensating. It's got to be pretty classic or pretty bad before I see a big positive Trendelenburg. This is one of the easier ways to see what's going on. And I think dynamic screening is as well. If it's a runner, you're gonna, what are you seeing in the hips as they run? Are they slapping side to side, right?
That's an important aside too for younger female athletes. Number one injury.
Huge. ACLs, yeah.
And a number one precursor is lack of glute med activation.
Yeah,
right?
Absolutely.
You see it in jumping. Right?
Yeah.
Watch girls basketball team, and guys too, but it's more common in young girls where they're jumping, here. Valgus, right?
Yep.
Yeah. So we're crashing in, we're putting a ton of strain on that ACL. We see the injuries all the time. So focusing on that glute med is massively important, not just for back, but for the knee as well.
Yep. So go ahead. I mean, so one of the great ways to do that, there's actually, while you're here, we'll go through, one of the ways you do this is a clamshell exercise. So having the patient lay on their hip, what you'll tend to see is that the person that's got really big problems with this will typically have a lot of problems with their TFLs. Okay. Right? So we talked about smashing that the other day. Yeah. They'll tend to have that in a contracture, a lot of IT band issues, and if they're runners, runners' knee symptoms, things like that. So they'll have a lot of problems related to that in the knee, hip, and whatnot. So when we go to work on this, they're going to go here with their hip, their pelvis, roll it back. By going here, it gives them the ability to fire that, and as that fires, it's going to open up. What we need is them to stay neutral. So a lot of times you end up, if somebody's doing stuff away from your eyes, you end up coaching them to get something like, I'll go behind, lean against the couch and put something that puts you in a little bit of a forward roll, right? That way it makes it a lot harder, and then I'll have them go and put your thumb right there, right on that glute med. So it's get right in there, and I want you to focus on squeezing really tight right there. And I want this to stay calm, right? Don't worry about your knee opening up. We're just going to do isolated contraction right there. And then slowly open up the knee. Right? So there's more cueing to that than just that, but this is a simple way to do it. And if you're feeling that fire and not this, by the time you get to 10 reps, even if you're a conditioned person, it's burning. You're seeing people sweating if you're actually doing it well, right? So you should feel crampy, kind of burny, just fatigue, big time fatigue, like you just got a good workout in.
The bigger the movement doesn't mean the better.
No, you can literally, your knee can go from here to here.
Yep.
That's it, right? Range of motion means nothing with that activation on benefits, or minimal, I should say, not nothing, but minimal. So oftentimes in the practice, we'll also use bands. If somebody's really struggling, and we'll band their knee, put them here, and then dig. And the reason that I dig, it's not very pleasant, right? The reason that we'll oftentimes do that is sometimes nociception, right, which are pain receptors, are the best way to wake up the brain. It's one of the easiest ways to do it. And I'm not saying put them through a bunch of pain. Nociception is just a precursor to pain. It's the neurological precursor. So sometimes you have to do that. So if I'm working on the core, any patient will tell you, I'm going to shove my finger sharply into their side.